So someone has said that they've caught COVID several times, and they
Mhm.
feel that their lungs are just not to where they were before. They just seem to get worse and worse. So they're not sure, like, what would they ask their doctor to look at because they've caught COVID several times.
Yeah, so uh, there's a number of things that the differential starts broadly in terms of, I guess, thinking about things that cause shortness of breath. Things can be lung related. It can be related perhaps to the COVID, perhaps related to a bit of scarring that's left over after COVID. And for that, we start to think about, for example, CT scans and breathing tests, and perhaps a referral to a respirologist. But then you also have to be cognizant that there are a number of other things that can cause, there can be heart problems, there can be anemia that can cause shortness of breath, and there's a long list that we can look at that, again, usually our family doctor is our first line of defense in kind of broadly looking at the common culprits, and then trying to hone in on what seems to be most obvious, or if it's not obvious at all, referring to the specialists that might dig in a little bit deeper with a bit of a finer shovel, I suppose.